Hello masterminds, welcome back to class. Today we are talking about bipolar disorders and we are going to be guided by the following outline to make our lecture even more structured. We will start by defining bipolar disorders, followed by the types of bipolar disorders. Then we talk about the signs and symptoms of bipolar disorders, and we are going to end the video by talking about the treatment or the management of bipolar disorders. There is a group of psychiatric disorders that is characterized by persistent and pervasive disruption in the mood of an individual. This group of psychiatric disorders is called mood disorders. There are various forms of mood disorders, but strictly speaking, mood disorders fall into two main groups. We have bipolar disorder and then depressive disorders. In today's lecture video, we are going to focus on bipolar disorders. But before we attempt to explain what a bipolar disorder is, we need to understand what mood is. I'm going to spend the next few minutes explaining what mood is, and when we are done, we link it back to bipolar disorders. The day-to-day feelings that we experience are called emotions. These emotions are short-lived and they are mostly as a result of circumstances. So an example is feeling happy when you see someone you love, or feeling sad when you hear a bad news. These are called emotions and they are short-lived and they are mostly specific to circumstances. However, when we talk about mood is a pervasive and sustained emotional feeling that is endured internally and impacts nearly all aspects of a person's behavior in the external world. Another way of understanding mood is by the definition of mood by the American Psychiatric Association, which states that mood is a disposition to respond emotionally in a particular way that may last for hours, days, or even weeks, perhaps at a lower level and without the person knowing what prompted the state. So simply put, mood is a word that is used to describe emotions that lingers for a long time. Let's use the following diagram to explain mood even better. This is a graphical representation of the mood of someone, let's say Pascal. This line represents the baseline of Pascal's mood, that is Pascal's normal mood. And it's okay for Pascal's normal mood to go up and down throughout the day depending on how he is feeling, or circumstances, or maybe even the weather, which is normal. It is normal for it to go up and down around this region. However, if Pascal's mood goes too low, such that it goes to this lowest point, we can describe Pascal as experiencing depression. In the same way, if Pascal's mood goes so high, such that it goes to this highest point, we will describe Pascal as experiencing a manic episode. This dotted line remains hypomania, that means below mania, but of course above the person's baseline behavior. So, a person having hypomania is experiencing a mood change that is above their baseline, but not high enough to warrant a description of mania. Now that we understand what mood is, let's come back to bipolar disorder. Bipolar disorders, as we can see, comes from bi, which means two, and then polar, which means the poles of a person's mood, in this case, mania and depression. A person experiencing bipolar disorder can have sudden or severe changes in their mood, such that they can swing from depression all the way up to mania, or mania all the way down to depression, and that is bipolar disorders. There are two main forms of bipolar disorders. We have bipolar 1 disorder and bipolar 2 disorder. We are starting with bipolar 1 disorder. A person experiencing bipolar 1 disorder experiences the highs of mania and the lows of depression. In bipolar 1 disorder, some patients will experience alternation of episodes where they can have episodes of mania, followed by episodes of baseline or normal behavior, followed by episodes of depression. Others too may experience mixed symptoms where they can swing from mania straight to depression and back to mania, all in the same day. When a person experiences mania, they present with a cluster of signs and symptoms characterized by dramatic and abnormally elevated mood, affect, and energy level. They experience a drastic change in their usual behavior, which significantly impacts their day-to-day activities. They experience euphoria, elation, periods of irritability, aggressive behavior, violence, reckless disregard for the safety of self and others, adventurous behavior and poor judgment, which can lead to sexual disinhibition, buying sprees, unwise investments, and giving their money out to strangers. Some of them may have decreased need for sleep, food, and limited attention span. Some of them may have a flamboyant appearance, such as wearing flashy and colorful clothes. In severe mania, some people can experience grandiose delusions, paranoid delusions, and even hallucinations. Some of them may have pressured speech or incoherent speech. It is important to understand that not every person experiencing mania is a picture of extreme happiness. Some of them are very angry and violent. Still on bipolar 1, another important symptom is depression, which is a state of pervasive alteration in emotion, during which a person experiences very low mood or loss of pleasure in nearly all activities. The symptoms of low mood is also accompanied by other physical symptoms, such as unexplained weight gain or weight loss, overeating or undereating, inability to sleep or oversleeping. During depression, a person may withdraw from friends and family, withdraw from work, lose interest in activities they love, experience loss of energy, and will have feelings of worthlessness and hopelessness. I believe that is enough for bipolar 1. Let's move on to bipolar 2. In bipolar 2 disorder, a person experiences periods of hypomania that alternates with depression. Depression, of course, I've already explained under bipolar 1, so I'm going to explain hypomania. Hypomania simply comes from the words hypo and mania, where hypo means below, and mania is, of course, what we have explained here. A person experiencing hypomania is having elevated, exaggerated, and expansive mood, but not as high and distressing as mania. If you look at this diagram, you realize that these dotted lines indicate hypomania, which is a step below mania, but also a step above baseline behavior. The signs and symptoms of hypomania typically last for at least 4 days. They are although distressful to the person experiencing it, but they are not as severe as mania and usually do not require hospitalization for treatment. In other words, the signs and symptoms of hypomania disrupt the day-to-day life of the person, but typically allows for continued functioning. Another important distinction between mania and hypomania is that in mania, a person may experience psychotic symptoms such as hallucinations and delusions, but these hallucinations and delusions never happen in hypomania. At this point, I believe we understand the meaning of bipolar 1 disorder and bipolar 2 disorder. So let's move on to the management of bipolar disorders. Under the management of bipolar disorders, we are going to talk about the use of medications, psychology, and nursing management of a patient with bipolar disorder. The kind of medications that are typically used in the management of bipolar disorders are called antimanic agents or anticonvulsant medications that are used as mood stabilizers. An example of an antimanic agent that is used in the management of bipolar disorder is lithium. For the anticonvulsant medications that are used as mood stabilizers, we have gabapentin, carbamazepine, and valproic acid. And finally, there are some antipsychotic medications that are used in the management of bipolar disorder. Examples of these medications include aripiprazole and quetiapine. Of course, the list of the medications are inexhaustive, but for now, let's take with the following. Now, let's move on to the use of psychology to manage the signs and symptoms of bipolar disorder. The use of psychology is effective during periods of normal mood or remission of symptoms. It also helps in reducing the risk of suicide and injury in people with bipolar disorder. Finally, it helps the person to realize the presence of the disorder and the need for treatment. We will end this lecture by talking about the nursing interventions used in the management of people with bipolar disorder. First of all, when you are nursing people with bipolar disorder, you need to provide them with a safe environment and speak to them using clear, precise language. You also have to set and maintain limits on the disruptive behavior they will present with. You also have to engage them in meaningful activities to provide a safe outlet for their increased energy or to relieve them from boredom when they are depressed. More importantly, you have to provide them with finger foods that are rich in carbohydrates and protein that can be eaten on the go, especially when they are in the manic state. And finally, you have to promote rest and sleep to aid with their recovery. This brings us to the end of today's lecture video. If anything is unclear, please ask me a question in the comment section and I will do my best to respond to this. Please like this video, subscribe to the channel, and share the video with others who will benefit from it. As usual, this is Masterminds Nursing. Fellow nurses, class has ended.